My name is Dr. Mir Asif from Miras Care Clinics. My clinic is in Gurgaon, India. The topic which we are going to discuss today is phimosis. So first of all, we need to understand what phimosis is. So nature has given penis a protective layer which is called as foreskin. This protects the glans penis. It's a protective layer which protects the glans penis. In some patients, they are not able to retract the foreskin behind the glans. Ideally, all men should be able to retract the foreskin behind the glans. The most prominent part of the glans is called as corona. You should be able to retract the foreskin a couple of millimeters behind that without any difficulty, whether the penis is in the flaccid or as well as in the erect state. So in certain population of men, they are not able to do this. That's what phimosis is. So what are the causes? What causes this? After birth, you won't be able to retract the foreskin for a couple of years. Then gradually and slowly it can be retracted. This is a natural phenomenon. So what are the pathological causes for the inability of the people to retract the foreskin? The first and foremost is repeated infections in diabetic patients, repeated trauma. What happens in these situations is that there is repeated scarring of the foreskin, and when scarring, the foreskin contracts, and you are not able to retract the foreskin. A lot of doctors, a lot of surgeons have tried to classify the phimosis in different ways. Some have classified it into mild, moderate and severe, some from 1 to 4, from 0 to 5. The most common, the most accepted classification is 1 to 4. So grade 1 to 4. So why do we need to classify this problem? The classification helps us in determining the subset of patients who will be treated with medications and local ointments and salves, and the other subset of patients which won't benefit with these with medical management, who will need some kind of a surgical procedure. So grade 1 is when you are able to retract all these grades, all these stages are in erect state. So stage 1 is when you are able to retract the prepuce behind the corona and there is some stretch in the erect state. Stage 2 is that you are not able to fully retract it beyond the corona. Stage 3 is when you are able to retract it and are able to see only the meatus. Meatus is the portion of the glans where from the urine comes out, the outer opening. And stage 4 is when you are not able to see even that. So why do we need to treat these problems surgically in some certain subset of patients is that one, it can cause infection because there is a natural secretion of smegma which is naturally occurring, and if you are not able to retract and clean it on regular basis, this is a milieu which causes repeated infections. And if these repeated infections keep on occurring for a long period of time, they can cause penile carcinomas, penile cancers. And then there is a smell which keeps on occurring, which is very unpleasant to you and to your partner. And the third reason is that because it is extremely painful to have sexual intercourse or to masturbate, people tend to avoid intercourse and end up in erectile dysfunctions. So it is one of the most common problems which are readily treatable for erectile dysfunction. So what are the treatments available? For stage 1 and 2, we generally treat it with local steroid ointments, then stretching exercises, and as well as certain rings. I am not a very big proponent of rings and forceful stretching, because as soon as you leave the stretching or applying the rings, the scarring occurs and you are back to square one, and the scarring occurs and you won't be able to retract it permanently. So when does the surgery help? Is circumcision the only solution? No, there are other ways of treating this problem. Circumcision is not the only solution. There is prepusoplasty, dorsal slit, and obviously circumcision. We will be discussing these possibilities of treatment in a different video. Kindly like, subscribe and share this video. Thank you so much.